This section of the video will be about the causes of EBDs. There are three main causes. The first is brain disorders, which can either be abnormalities in formation of the lobes of the brain or a traumatic brain injury that occurred later in life. This is not the largest category of causes, but it does create behavioral problems in a good amount of students. The second is genetics. So many mental illnesses are inheritable. For example, both of my parents' parents have bipolar disorder, and my parents have bipolar disorder. When I was young, I was diagnosed with bipolar disorder. Later, psychiatrists have given me different diagnoses, but again, from generations, it is genetic. The last category is environmental factors. Within environmental factors, there are different categories of environment: home, school or work, and community. And so I'll begin with home. The home environment, like any environment, can either be very positive and enriching for children growing up, or it can be very, very toxic. For example, as you can imagine, having two parents who have mental disorders, where I grew up was very, very toxic. That's one of my causes for my EBDs. In school and work, children spend a lot of time in school, so their teachers, their peers, all of the staff of the school, and the environment and how they feel in that environment really affects who they are and their development. The community does as well. I will now tell you about the conditions that are under EBDs. I will begin with all of the anxiety disorders. So anxiety disorders is the umbrella term of maladaptive emotional or behavior caused by irrational fears and worries. Generalized anxiety, I'll go with this one first, is like excessive worrying all the time about pretty much every aspect of that person's life, and it causes a lot of tension. Social anxiety, which is something that I have, causes people to be very uncomfortable within social situations. I personally get physical symptoms of feeling like I'm choking, or I just shake really bad. Phobias is an irrational fear of just any category of things: heights, bugs, spiders, people, anything that someone could have a fear of. And most likely this fear has come from an incident that has happened, but it is still irrational. Panic disorders, I used to have this very badly. So when a person has anxiety, sometimes it will come in the form of a panic attack. So for me personally, I'm a paper doll, my body would stiffen really bad like this. And I was actually in a wheelchair in my 9th grade year for over a month because I couldn't loosen from my panic attack. And the next, still under the umbrella of anxiety disorders, is obsessive compulsive disorder. And you can think of it as having two components. Obsessions are thoughts. So, for example, a person could obsessively think about germs when they touch things and not want to touch doorknobs or other people's hands, things of that nature. And the compulsion is the behavior. So because they have these obsessive thoughts about germs, they compulsively want to wash their hands. And that's just one example. The next is about eating disorders. Anorexia nervosa is when a person refuses to eat food because of how they feel about their body and their body image. So they want to lose weight and be skinnier, so they do not eat, which is very unsafe. So is bulimia nervosa. It manifests a little bit differently. People eat and they gorge themselves, and then they vomit all of that food back up. Number 4 on my list, post-traumatic stress disorder. This one affects me almost every day. Most people think of post-traumatic stress disorder as something that soldiers get, which is very true. Those can be very traumatic experiences. When they come back, you get flashbacks, bad dreams, you get very jumpy, like if you hear loud noises. Loud noises are one of my least favorite things. And lastly, selective mutism. That is when a child, in certain situations, does not speak. They are able to speak when they are comfortable, but some situations, because of past experience, has made them uncomfortable, so they refuse to speak. Going back to post-traumatic stress disorder for 1 second, because I missed some things. These, like the soldiers in war, it is really, really caused by the environment and a traumatic incident that occurred. I didn't mention that, but it's really like usually one big event or one traumatic event that occurred over and over again, which is where mine stems from. The next that I will talk about are mood disorders. The 2 main mood disorders are depression, which is a overall pervasive mood of unhappiness that usually lasts over 6 months. Sometimes it is caused just by the brain chemicals not functioning correctly, or events that occurred in one's life. The next is bipolar disorder, which, as I mentioned before, is certainly a genetic disorder. Both of my parents have it. It was originally called manic depressive disorder because within this, people experience very high euphoria for a few weeks at a time, and then they'll go into depression. So it's always this flip-flopping. And lastly, other disorders, schizophrenia, which is characterized by hallucinations, delusions, lack of cognitive and executive functioning. This one can be very scary for people that have it. For example, someone could always have hallucinations that fires are occurring, and then they have to deal with the fact that there's not really a fire. And I don't know if that was the best example. This one I worry if my mother has as well, because she has persistent delusions of persecution, which is a big, big thing with schizophrenia. And lastly, Tourette's syndrome, which is characterized by motor and verbal tics, so like blinking of the eyes or like that, which can cause impulsive behaviors in students. This section was about all the causes and the conditions of EBD, which is very important for you to understand which section of EBD your student has in order to best plan interventions and lessons around that.